Okay, back again today with the next portion of the women's health webinar, and today we're going over evidence-based. Like, what does evidence-based mean? So when I practice evidence-based acupuncture, basically it's kind of been applied through the rigorous scientific standards that we have today in science, right? Western science. So one of the ways we test is through random controlled trials, which we will talk about, but generally, because they're sort of statistic based, the numbers can always be manipulated for worse or better, generally in the favor of one interest or the other. So I don't really care for them. We will talk about them, we'll bring it up, but the ones that I really like the best are what we call basic scientific studies. And what people don't know about acupuncture is that because it was so safe, because the side effects are minimal, they really bypassed any sort of animal studies. So a lot of times when you test a pharmaceutical, you want to see how it affects the physiology. You test it on rats because rats are generally very similar physiologically to humans and stuff like that. And you look. So if it's harmful, it doesn't go, it doesn't move up to a human trial. But because acupuncture had such a long history of not hurting anybody, they just went right. But they didn't really set the protocols properly, and they were just, not doing it properly. So I don't like them, and even with what we've proven with a lot of stuff, because think about a lot of stuff we use today that's considered evidence-based, like look at opiates. Yeah, they sure work, but look what it did to today's society. So what I like is scientific models, but we will address randomly controlled trials and things like that. So I always tell, as part of like the patient-centered aspect, I try to explain how acupuncture works. And we've talked about this multiple times over and over again, but it bears repeating because it's important. So locally, what we're doing is we're with the filament. When we insert the filament, we are increasing circulation to an area. So yes, lower abdomen, we are increasing circulation to a uterus, to an ovary. And by bringing circulation, you are improving the function. So think about like a cut. When you cut yourself, you don't bleed out and die, right? The body fixes it. So we're harnessing that mechanism to improve the function and the tissue of an organ. So there's the function of an organ, and there's the actual organ itself. So an ovary itself or a uterus itself can't function properly if you don't, if it's not healthy. So the way we improve health to the organ is increasing circulation. Just like the cut, we're bringing circulation to the uterus, we're bringing circulation to the ovary, and it functions better. So when we talk about function, the job of the ovary is to produce eggs, ovum, and the job of the uterus is to carry children. So we see with uterine lining improves with acupuncture, and we also see ovulation. But ovulation is based on regulating the cycle, which is very important. So that's there. So regionally, that signal travels up to the brain. So if you have pain like cramps, so if you have pain like, hey, what's up, Wilkes? Long time no see or hear. So basically what we're trying to do is use the nerve pathways to get these signals to the brain. So if we have pain with cramps, or we have painful periods, or we have endometriosis, we're trying to block that pain signal in the nerve pathway, right? So that's the regional effect. It's like the hot tub effect, right? When you stay in a hot tub, it doesn't stay hot. The body modulates it. So the body modulates the signal from the acupuncture needle in the nerve pathway, and then finally it gets to the brain and releases endorphins. And endorphins further relieve pain, but they also regulate autonomic function. So when you're under stress and you produce cortisol and it throws you into sympathetic, then you can't regulate the function of these organs. So acupuncture releases endorphins, and it puts you in a state of parasympathetic rest and allows the body to do what it's supposed to. Think about it. You don't really control your cycle. You don't control your period. You control your digestion. It's based on the autonomic nervous system. If that's not working properly, then it has to be, we have an intervention directly through the endorphin release. The other effect, which I've studied to great effect, is the epigenomic growth. So what acupuncture does is it basically turns good genes on and bad genes off. So we want the good genes of the uterus to improve and improve endometrial receptivity, so that we can accept the transfer or have a conception and have an implantation and develop have proper fetal development. So we are actually improving the tissue through the genome. We are telling the genes and the DNA within the uterine lining cells to work properly, right? Ask them to do their job. The same thing with the ovary. Like, think about an egg cell. An egg cell is still a cell, and it has genetic material. So that specific cell in the body needs to be, improved on a genetic and genomic level. So those are the 4 ways we, acupuncture works, and that I share with all my patients. So let's get the right mouse here. What have studies shown? Studies have shown in real time, these are the basic scientific studies, right? That increased flow to the uterus, which increases uterine lining, increased endorphin production, which regulates. So the way the signal gets from the brain to the reproductive organs is through the pituitary gland. So the pituitary gland has to release a certain hormone. So the brain tells the pituitary gland to release a certain hormone, which then regulates, the menstrual cycle. So what happens is, because we're so much under stress, that system, that gatekeeper, that the pituitary gland gets kind of thrown off. So what acupuncture does through endorphin releases allow the pituitary gland to signal, proper function to the reproductive organs, which in turn lowers, cortisol, which improves fertility, and kind of balance. So once we regulate that, we can balance all the hormones in the bloodstream that regulate the cycle, and which basically regulates the hypothalamic pituitary ovarian axis, and it also helps with polycystic ovaries. Specifically, we're going to talk about ovulation. We're going to talk about cramps. We're going to talk about menopause, IVF success, and frequent miscarriage. So we have seen through studies that the use of acupuncture alone outperforms with ovulation than with the use of Clomid, because it normalizes the hormone levels in the blood and allows the ovaries to produce better eggs. Another test was done to show that acupuncture outperforms period cramp pain better than actual over-the-counter. And not only does it improve the pain, it gets rid of it, and we're less dependent on pharmaceuticals. So again, by regulating the hypothalamic pituitary ovarian axis, we can have better cycles, we can have better pain-free periods. Menopause and hot flashes. Several studies have been done on this to show with great effect, and it shows that with self-care, there are significantly clinical results that improve the frequency of hot flashes. So not only does it reduce the intensity, it reduces the frequency to the point where people don't have hot flashes anymore. And another study was done to show that the way it does that is it regulates how the blood vessels open and close. So in order to produce heat in the body, you shrink the blood vessels, it creates resistance, and that's how you get a hot flash. So by further testing and again, basic scientific studies, we see that it regulates the mechanism of how the blood vessels work. So we create vasodilation, we open up the diameter of the blood vessels, there's less resistance to the blood flow, thus less hot flashes. And the other big benefit through the studies is shown that there's long-term effects, right? There's no dependence on medication. You don't have to take, hormone replacement therapy or something like that. Is that if you do a consistent course of acupuncture, you improve how the physiology works, and then you reduce the symptoms, right? It's all about correcting these physiological mechanisms that cause the symptom. It's not about the symptom itself. It's about regulating physiology and getting the body to work properly. Menopause. Now, IVF success. One study indicates that IVF success rate improves by 65% when you're doing acupuncture with IVF. There's multiple studies to indicate that it helps live birth rates on the day of, but I believe that's a little short-sighted and it's a little old. So anybody out there that hears about IVF and acupuncture on the day of, it's a little bit short-sighted. Okay, we could do a lot more with better improvements if we treat up to the point, because if we look at it as like a symptom of not being able to get pregnant and have a baby, right? We're not looking at the why. We're just looking at the symptom. If we get to the root of why that happens, then we can kind of correct up until the point, why do we need IVF? If we're able to regulate the physiology, we can help in case the IVF isn't successful. And I can tell you this firsthand because oftentimes my patients, from doing all the work with the acupuncture, will actually, get pregnant in between cycles without the transfer while they're waiting for the next transfer. Once everything is kind of set up properly, then they can get pregnant on their own. So what we've seen is that more acupuncture sessions were twice as likely to have a baby compared to women who did IVF alone. And then 60% more likely when compared to women who just had 2 acupuncture treatments on the day of embryo transfer. So that's IVF success rates. Frequent miscarriage. Now, you can have multiple IVFs and you can have multiple chemical pregnancies. You can get up into the point, but something happens where it doesn't develop, right? The embryo attaches, it doesn't develop, and something, unfortunately goes wrong. But with the use of IVF, there was a study done with at least 114 patients to show that people who did IVF and acupuncture had more pregnancy rates, but also in compared to groups that didn't have acupuncture, the pregnancy rates were significantly higher. So the punchline is do acupuncture with IVF. As I said before, as I was treating these IVF patients, I was seeing that they had symptoms of menopause, right? They would have hot flashes, night sweats, palpitations, anxiety, dream, disturbed sleep, insomnia, and things like that because, there's an imbalance. So you're actually flooding the body with artificial hormones to get something done. When you look at a patient who has a perimenopausal sort of profile, they will have hot flashes. So instead of just treating IVF, we can treat hot flashes. And then the punchline is, in my career, talk about cramps. There's oftentimes, young women will start their period and they'll have issues. They'll have problems. It'll be, painful and cramping. And then with the hormone fluctuations, you'll have some emotional stuff. And the answer is to put them on the pill and then, put them on antidepressants. That again, you're just chasing symptoms. You're chasing the symptoms of the cramp. You're not trying to regulate the underlying problem, which is correcting it, because that same patient, this is the irony, right? This is the pitfall that the medical system creates more problems, is that young lady who's been put on the pill will eventually 15 to 20 years down the road want to get pregnant, right? And she won't be able to because she's been on the pill for 20, 30 years, however it is, whatever she decides to have children. So if you can catch it early enough, acupuncture, you can start it early. You can help sort of like streamline a lot of these problems. It's not about, going for IVF. Try the acupuncture first, right? The rule of thumb is like any woman under 35 who's having trouble getting pregnant, she has about a year before she gets sent to a fertility or a reproductive endocrinologist. Why not in that meantime? I'm not saying don't go get an opinion. I'm saying why not try acupuncture, right, along that time? Chances are you'll probably get pregnant. But, at least you can prepare your body to avoid these multiple IVF, failures and stuff like that. So, and also when you present these symptoms of, perimenopausal, it doesn't mean that that's the end of the road and you have to suffer with it. We can get a grip because at the root of it all, if I haven't stated this enough, is that acupuncture regulates the hypothalamic pituitary ovarian axis. And by doing that, you can treat a lot of stuff. You can treat and you can help a lot of the symptoms that kind of come up. And that is the end of the evidence-based portion of the lecture for gynecology. Next time we talk about, once this is all successful, once this all works, then we'll talk about obstetrics. And as a final closing thought, I just want to say that there's no wrong or right answer to this, right? Like IVF is not a wrong or right thing. Nobody's telling you not to do IVF. Please be very clear that I don't recommend that for anybody. If that's what you choose to do, just know that acupuncture can help. And also that if you're not doing IVF or you don't know about it, or don't rush out to IVF first, get your ducks in a row with acupuncture. If you get pregnant, great. Then if that doesn't happen, then we can look at other alternatives like, assisted reproductive science. So that being said, I wish you all a good night. Thanks for listening and paying attention. And we'll be back probably Thursday, and we'll talk about what happens after you get pregnant, right?